Africa stands on the brink of a potential health crisis. The continent is edging closer to declaring a public health emergency over the alarming rise in Mpox cases. With nearly 900 cases of this viral infection reported in just a week. Our next report delves into more detail about this infection and whether the situation can be contained.
The Africa Centers for Disease Control and Prevention has made it clear. The continent is edging closer to declaring a public health emergency over the alarming rise in Mpox cases. The situation has escalated so rapidly that the Public Health Agency has already initiated active engagement with African Union member states to contain the outbreak before it spirals out of control and becomes a pandemic. Mpox has claimed 461 lives this year. Over the past week alone, the continent has reported 887 new confirmed and suspected cases of Mpox, bringing the total for the year to a staggering 15,132 cases. These numbers represent a 160% increase compared to the same period last year. What is Mpox? It is a viral disease that causes painful rashes and flu-like symptoms. 16 countries have reported cases, with the Democratic Republic of Congo having the highest number, more than 90% of the cases. In fact, for some nations like Burundi, Kenya, Rwanda and Uganda, this is their first encounter with the virus. The World Health Organization indicated that an emergency committee might soon be convened to decide whether Mpox should be declared a global emergency. This would be a significant escalation. The virus was first recorded in humans in 1970 in what is now the Democratic Republic of Congo. Until 2 years ago, it was known as monkeypox. While the West has managed to bring the spread under control through the use of vaccines, Africa finds itself in a much more precarious position. The continent faces a severe vaccine shortage, with only 200,000 doses available against a demand of at least 10 million. Experts cited this shortage as a significant obstacle in controlling the virus's spread in the continent. The African Union recently made an emergency allocation of $10.4 million to support efforts against the Mpox outbreak. The specter of a more virulent strain of the virus, reported by scientists in the DRC in May, looms large. This new strain is believed to be more contagious, which could make an already dire situation even worse. The stakes couldn't be higher. The lives of millions potentially hang in the balance, especially in a continent where health infrastructure is already stretched thin by other endemic diseases.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.